First up, though, help reduce the risk of falling. As the season changes on Wednesday, it also marks National Falls Prevention Awareness Day. And our next guests are helping bring to light this issue while teaching you ways on how to stop the risk. Here with more is Dr. R.J. Williams along with Cameron Deems, both with Physical Therapy and Balance Centers. Good morning to both of you and welcome.
Morning. Morning.
Dr. Williams, let's start with you. Can you tell us more about what National Fall Prevention Awareness Day is all about?
Sure. So National Fall Awareness Prevention Day is something the profession of physical therapy has taken across its entirety to help seniors reduce the risk of falling. We've recognized it as a huge challenge, and our company Physical is making a huge campaign this year to really dominate the marketplace in helping people get better.
Is this a huge problem with seniors falling?
It's a massive problem. So the numbers on it are outrageous, and they're scary, and they're growing every year. So there definitely needs to be work in stopping it.
Now, Cameron, tell us about the impact of falls and what you've seen.
Absolutely. Impact of falls and imbalance in falls are a known danger amongst Americans elderly. And according to the National Council on Aging and the U.S. Centers for Disease Control and Prevention, 1/3 of Americans aged 65 or older fall every year. And actually, every 13 seconds, an older adult is treated in the emergency room for a fall, and every 20 minutes, a person in the U.S. dies from a fall.
That's big numbers there. It's very scary.
Absolutely, absolutely.
Yeah.
And falls is a leading cause of death due to injury amongst older adults, and the most common cause of non-fatal hospital-related admissions amongst older adults.
Yeah, and there are a lot of older people living alone, so we don't know what's happening to them, and there is help there, which we're going to go through in just a moment. But we have some video of your services, and we want to pop that up. Can you describe to us what we'll be taking a look at right here?
Sure. So we have 2 clinics here in Las Vegas. They feature an overhead harness system, and the gentleman you're seeing here is actually not in the harness system, but working on some drills specific to throwing discus and shot put. He was a client of ours that was in the military, suffered obviously a leg amputation, but a whole host of other injuries. He trained initially with what we do in the rail system, then worked his way out to being able to do these rapid spins and turns and not have issues of feeling dizzy. Here you see some testing that we provide to all of the patients that we see to appreciate and understand what's going on. And there's a look at that overhead safety system.
And this is in a safe environment. They're not going to fall, some of these seniors that are going through the tests. So it's really important that they also get tested, isn't it?
Correct. So the importance of the test is there's a bunch of simple things that can be done, and we look at these issues with falls as very preventable.
What is this?
This is a chair that helps reposition debris that can get loose in the ear and cause vertigo. So what happens is these things get out of place, and it causes a mismatch of signals to the brain of where you're at in space, and people feel off balance and dizzy because of it. So for some people, it's really hard to extend the neck back and do the treatment that's needed. That chair lets us spin them in place, and they don't have to do anything but sit back and relax.
You're really on top of all the cutting edge technology.
Right. So our centers feature some of the greatest technology in the nation. So people have actually come from across the country and even across the nations, different countries, to our clinics to be treated for balance.
Now, Cameron, can I schedule a fall risk assessment either for myself or maybe for my loved one?
Okay. Well, our client care specialists are standing by, ready to schedule you for one of those fall risk assessments. Just go ahead and call over to our number. Number is 702-880-1515.
And how long does an assessment take, roughly?
It takes about 15 to 20 minutes and everything from the time that you enter into the clinic to the time you're out the door again.
And if you're bringing your loved one, it's really a peace of mind for them, isn't it?
Absolutely.
Right.
Yeah.
So we have some great educational materials too that patients can take home with them, and it's things that they can do just around the house to improve their safety as well.
Yeah, what are some of those things that we can do?
So there's simple things like throw rugs. Oftentimes as you start to get older, you shuffle your feet a little bit more when you're walking. It's easy to catch your feet on some of those things. Or some simple home maintenance things like making sure all of your lights are working and somebody's stopping by to help you change light bulbs if you need it, rather than climbing up on a chair yourself. But having night lights is a great way to keep yourself safe while walking in the dark.
A lot of people probably are in denial that they have a problem. They don't want to admit that they fell. What can we do to talk to our parents or convince ourselves that we need to go get tested?
So it's really simple that none of these things are going to create a problem where you can't maintain independent living. And I think that's one of the big things, is a lot of times people feel if they find out that I may fall or get hurt, then I'm going to have to go live somewhere else and I'm not going to be able to live on my own. And so a lot of this is preventable, and it just needs to be caught early before it's a problem.
And that's why you're there. You're there to help people live an independent life, get back on their feet, teach them skills, and so they can go back to a normal life, right?
Exactly.
Yeah, and we do have another picture that we want to pop up, and I want you to explain what that picture is.
Sure. So
here.
it's a handful of questions. So it has some information about National Fall Awareness Month, but these are simple things that you answer yes or no to. So are you nervous about falling? Yes or no. And obviously the yeses accumulate points, and at the bottom you see a scale there. The more points you get, obviously the higher risk you are for falling. Yeah,
you don't want to lie about it. This is there to help you, to protect you. And if it's there and it's an easy quiz, just be truthful about it, right?
Right.
As a parent, or like, I know it's so hard because you don't want you to see your parents go through that, but if they need help, they need to get it somewhere.
Definitely.
Yeah, and you guys have a special going on as well.
Correct. So for the entire month, not just Fall Prevention Day, we're going to open up your ability to come in and get assessed for free. So we want anybody to be able to call us up, walk in and go through this 15-minute test, and that'll help us screen as many people as we can for this life-changing issue.
Yeah, well, thank you so much. Some great information for us.
Thank you.
Appreciate it. Remember, all month long, Physical is offering free fall risk assessments in order to bring to light the negative impact falls have in the U.S. To find out more about physical therapy and balance centers, just call the number or head to the website right there on your screen. They have locations in Las Vegas and Henderson.